Good evening, everyone, and I hope you're having a wonderful first week back at UT Dallas this fall, and you're getting settled in your classes and figuring out what to do. So this is the first of the multiple research snippets that we have for you, where we're presenting to you the kinds of research that the faculty do in bioengineering. So I'm Shalini Prasad, and I am a professor here, as well as the department head. And my lab is the Biomedical Microdevices and the Nanotechnology Laboratory. And my lab's research focuses on human-centered engineering design. And our goal is to develop biosensors and sensor devices that enhance human quality of life and essentially help with diagnosis and intervention therapies. So we designed rapid, portable, and biodegradable sensors. So here you see some of the technologies that we have developed and how they have gained a lot of interest. So to the left here, you have Ruchuta Munje. She earned her PhD in my lab, and she currently works for Texas Instruments. And she designed the first wearable glucose sensor for detecting blood glucose from sweat. And it's a totally passive sensor that sits on the skin of the user and reports it in real time. The student in the middle is Badri, and he's a current PhD student, and he is developing the wearable version of the initial sensor towards detecting not just glucose, but a bunch of other biomarkers from sweat. And on the far right is the group of students and researchers who worked in my lab in developing various aspects of wearable tech. So to the very left is Ramesh Ganta, who graduated with his bachelor's degree here at UT Dallas and is currently in med school. Then there is Dr. Kai-Chun Lin, who is currently a research scientist in my laboratory. And to the far right is David Kinnaman, who's pursuing his PhD at Duke University after having worked in my lab after earning a bachelor's in biomedical engineering in our program and working in my lab for a couple of years and earning a master's in my lab as well. So the idea here is that we do collaborative research with undergraduate and graduate students, as well as senior researchers, towards developing innovative and pioneering technology. So today I wanted to talk to you about the example of the glucose sensor. So there is a severe unmet need for real-time monitoring and continuous monitoring for a wide range of chronic and acute diseases. So chronic diseases are like diabetes, post-traumatic stress disorder, IBD, and sleep disorders. Acute diseases are like infection, influenza, pneumonia. So there is a huge need to be able to identify and screen rapidly for these diseases, understand the disease progression, and see whether the therapy that's being provided is helping with managing the disease. In order to do this, there is a significant need for interventional technologies, and that's what we designed. So the diabetes epidemic is huge. There are over 500 million people right now who suffer from diabetes, and there are two types of diabetes, the type 1, type 2 diabetes. So type 1 diabetics are those whose bodies does not produce insulin, and generally younger people, children, get diagnosed with this. And type 2 diabetes is when your body does produce insulin, but your body doesn't use it well. So in this context, lots of people essentially fall a victim to type 2 diabetes. And there are other downstream effects such as cardiovascular issues, pulmonary issues, so on and so forth. In fact, the current COVID pandemic is further exacerbated in patients who have diabetes because the outcomes are more fatal for them. So it's very critical to manage diabetes. And the way to do this is to have a very good control of the blood glucose level, an understanding of what it is throughout the day, and adjusting the lifestyle to maintain that sugar content over an acceptable range. The cost of dealing with this is over $800 billion, and the associated health impacts is significant, not just in the United States, but over the globe. The way it is managed right now is that there is this finger prick test, and most of the type 2 diabetics and some of the type 1 diabetics do this. So they prick their finger, look for blood glucose measurement as it's shown in this picture, and then they use that to manage their lifestyle, that what they consume, when they consume, and how much exercise they get. So on average, a person has to do at least 5 finger prick measurements a day. This translates to just about 30,000 finger pricks a year. So you end up becoming a human pain cushion. So there's not just physical pain, discomfort. The invasiveness of the testing makes people want to do lesser of these tests. And then, of course, there's this anxiety and this lack of motivation to do this. So if there exists a platform technology that allows for real-time, non-invasive and passive monitoring, this and gives alerts exactly like how we get alerts on our phone for bad weather, if we could get the same, telling us that our blood glucose level is low or high, we can accordingly make adjustments. So towards this end, there has been a big push in the wearable sensing platforms towards address this. So the commercially available ones are the Dexcom and the Abbott's Freestyle Libre, and more recently, one undergoing clinical studies is GlucoWise. So both they go from being minimally invasive towards completely invasive. All of them have, to a certain extent, discomfort associated with them and significant variability in their measured response, especially with the GlucoWise platform, which is an optical platform. So what we have developed here at UT Dallas in collaboration with a number of startups locally is this device, which is the wearable device, which can measure for blood glucose from sweat in a completely passive manner. It's an electrochemical sensor that reports to a smartphone the blood glucose measurement as determined from sweat. So, and this shows you the various ways in which this platform can be worn. And this is a truly non-invasive sensor which looks at low sample volumes, can do continuous glucose monitoring with up to a week battery life. Now, if you want to do research in my lab or participate in the research activities in my lab, you would need to learn electrochemistry, electrical engineering. You would need to have some material science knowledge. You would need to know coding, programming, and you would need to know MATLAB or Python to do analysis, data analytics, and you would also need to understand your chemistry very well. So you don't need to do all of it. Now, your interest could be at the sensor development where the chemistry is more important and the electrochemistry is more important, or it could be where you want to look at data and design algorithms, in which case your knowledge in coding and programming is more important. Or your interest could be the hardware, designing that little wearable, which you can see that white box there. Now, if that's the interest, then of course your ability to do circuit design is critical. So now, doesn't matter what your interest is, if it aligns into this big interdisciplinary spectrum that's there in my lab, then that's great. And I'd be happy to have you come and interact with us and work with my lab and pursue your research. Now, it requires a commitment, an exclusive commitment of about 15 hours a week. And depending on your background, interest, and fit, you'd be paired with a PhD student or a senior researcher. And the commitment generally we look for is a year-long commitment, because it takes a lot of time to train you, get you up to speed, and then to get you focused towards getting the research going. So this, I hope, gives you a good overview on the kinds of things we do at BMNL. Once again, welcome and have a great fall semester.